Hey, chiropractors, welcome to Modern Chiropractic Mastery with your host, Dr. Kevin Christie, where we discuss the latest in marketing, business, and professional growth with some of the leading experts in the industry. Welcome to another episode of Modern Chiropractic Mastery. This is your host, Dr. Kevin Christie, and today I'm excited to bring Dr. Benjamin Fergus onto our podcast. This will be the second time, but we're going to dive into a little bit of a different topic, and excited to dive into his development and concept around the non-surgical joint replacement and how it pertains to knee, shoulder, hip, and what he's doing to help patients out and help chiropractors help patients out to avoid the actual surgical hip, knee, joint, shoulder replacement, and what patients are doing in his clinic, and then what he's doing to help chiropractors implement this system that he's developed with that clinically. And we dive into it. We dive into the details of it, how it started. I commend him on the naming of it. I love it. And so we every so often love to have really good clinicians on here to dive into the clinical side. And then, I'll provide a little bit of my business and marketing touch to it as well. So without further ado, here is my interview with Dr. Ben Fergus. All right. Welcome to the show, Ben. I appreciate having you on. This is the first time. It's been a little while since you've been on. So update our audience on what you've had going on over this period of time.
Yeah, thanks for having me on again, Kevin. I know I haven't been on in a while, but since we see each other 4 times a year, feels like it hasn't been much time. Yeah, I think things are good. A reminder for the listeners, I practice just outside of Chicago, Illinois in Evanston. And aside from my private practice, I hop around and teach and participate in seminars. So I've been doing a lot of teaching recently. I teach for some different organizations like Texas Chiropractic Association. I'm doing a series with them the past few years, both their big state conventions and then some little regional ones as well. I'm teaching for the Academy of Shockwave Excellence, and my time in between, where I'm not teaching with my own material, grip approach, I'm really focused on just building my practice in terms of the people I work with and the culture that we're establishing, and just leaning into that, and I've seen a lot of benefit from that.
Yeah, it's been cool over the years. You were an original cohort in 2022 of the mastermind, but we've known each other some years before that.
Mm-hmm.
And I think the thing that stands out to me about you and a lot of our mastermind members is that you're very clinically oriented, but you also are willing to dive into the business side of things and make sure that you marry great clinical outcomes and clinical delivering, whether it's you or your team members, but also, understanding that it is a business and we got to make a business out of it.
Mm-hmm.
And the better the business is doing, everybody is going to benefit from that. So that's something that's been cool to see over the handful of years we've worked together through the mastermind.
Yeah, I appreciate that. I agree with you. I am like 110% clinically minded.
Yes.
But the business helps you with that. And that was a big realization for me, is the healthier the business side, the better equipped I can be to do what I really want to do on the in-depth, nerdy clinical stuff.
Exactly. And it's been neat to see a lot of members in our mastermind like that. And then you obviously have the kind of the dual thing going on, which I've always admired of chiropractors, where you're not only in the trenches in your own practice, but you are teaching other chiropractors. How are you managing that dichotomy?
At one point I was teaching this or hosting this class, a DNS class in Durham, North Carolina. And our instructor was Brett Winchester, and the whole thing almost got canceled by this crazy snowstorm. My flights got canceled, drove through the night from Chicago. His got rerouted. But it was really cool. We got to chat there, and I asked him a question kind of similar to that, because he teaches probably a whole lot more than I do. Mm-hmm. And I asked him about that question about how you seek balance between professional life, personal life. Mm-hmm. And he kind of joked that there really is no balance. Balance is kind of an illusion. And I took that to heart. Not in a like I'm going to work all the time type of way, but the real, I think, way to find that balance and equilibrium is to just really enjoy what you're doing in the moment, no matter what that is, whether it's work or playing cards with your kid or whatever it may be. It's like fully invest in the moment that you're in. And then that kind of helps me uh, reframe the flights back home at 2 a.m. from teaching in Iowa when I'm working the next morning.
Yeah, it's I reference it often, but Cal Newport, he's in the midst of writing a book called The Deep Life. He wrote the book Deep Work. He you can Google the blog he wrote on Deep Life, which I really liked. It was kind of four parts, and but one of them was craft, right? And
Hmm.
he dives into those that really enjoy their craft and the process of honing that craft, you get a lot out of that. And
Absolutely.
I think that's sometimes unsaid.
Yeah. I think craft is a huge part of it, and mission is another one. And this is definitely see this in my group is
Mhm.
if you don't have like a really clear mission of what you're trying to do at work, then it's just work. And if you have a mission, but not everybody is on board and that mission doesn't resonate with them, then again, it's just a job. And I don't really want to be in a position where I'm just giving a job. I want to like to have a really fired up team of people that's working on a mission. And then you can lean into like the craft of it, the excellence of it, moving things forward together. And that really does motivate me every day too.
Yeah, no, it's great. And you know, you've been doing a lot, and I forget how I first heard of it, but it just it really stood out to me. And I just love when we marry great clinical and messaging. It might have been Jeff Fluid. I think you hosted at his office at one point,
Hmm.
maybe, right? But was the idea of the non-surgical joint replacement and that titling of it, and then applying it to the hip, the knee, the shoulder, and what that is, it really stood out to me. It's like, oh wow. And then I talked to a handful of people that have taken this course with you, and the substances there, like the material that they're learning and the things they're able to apply to their practice is there. And so it's got the great clinical underbelly to it. And then I just think it's a great title too, to be honest with you.
Hmm.
How did you come up with this? Obviously the start with the concept of what you're teaching of it, and then we'll work to the title of it.
Yeah, there's a whole lot of power in a good name, and
Yeah,
we
there
just
is.
sometimes you try to get the right name for something and it doesn't work, and other times it's right there.
Yeah.
Kind of funny story on the name. I had the technique, I had the approach that we're doing, and I wasn't thinking about teaching it to anybody else. I wasn't thinking of naming it, but I we posted something on the social media of, a technique we're doing, and I was just trying to grab some attention, and I kind of
Mhm.
in jest called it the non-surgical hip replacement.
Yeah.
And it blew up. It resonated with a lot of people. I had like local ER docs pop in to see what it was about. And like, oh,
Yeah.
there's some power in that name. So we went through the process of trademarking it and kind of
Yeah.
leaning into it and ended up naming the seminar that. But that was like a random social media caption that really took
Uh,
off. But behind that is a really robust clinical system that's evidence based. It's new material that supports some existing knowledge and material that we had from the research. But there's a lot of new development, novel approaches that are put in here to help make the attendee the best choice for a patient to conservatively treat degeneration in the knee, the hip, or the shoulder. And we apply the concepts to other joints, but the systems we teach are really focused on hip, knee, and shoulder. And if you look at patient volume, that's probably similar to an ortho office. 70% of the people seeking us are going to be those knee cases. Probably our most outstanding results, like mind blowing results, are with the hip.
mhm.
And the shoulder is really fantastic as well. But everybody who treats frozen shoulder and rotator cuffs and shoulder degeneration knows how sensitive that joint can be in comparison to some of our bigger joints like the hip and the knee. Um,
Yeah. Go ahead.
yeah, go ahead.
No, I said it makes sense to me.
Yeah. Yeah. When we try to market, I really want to get 100 hips walking into my office where we can prevent their need for hip replacement. And we end up getting about 100 knees and maybe one or two hips trickling in. But the background of it is my clinic and my mission, like we talked about before, our clinic mission is to resolve chronic pain in Chicago and then the world. And I've always been in this realm of chronic pain. It then kind of transitioned into athletic care when I realized that pro athletes, collegiate athletes are often, fighting through some chronic conditions. And I kind of married those together and worked that into grip approach, which we teach. But as the years went on, as I really specialized in these chronic complex cases, early on, a lot of the sources of the chronic pain had to do with nerves
Mhm.
that were inflamed, impinged, irritated, or injured. Then we were looking at muscle and connective tissue. And as we kept going, we had more and more patients where a degenerative joint was really at the epicenter of why their health deteriorated, why they were in a chronic state of breakdown. And I didn't even really think about trying to have an answer for that. I did as I was trained, and as you were trained, you get somebody in with grade 4 knee degeneration. What do? You get him connected to the best ortho surgeon you know, right? And you say, like, I'll try to make you feel better until then. And I think that was the mode of operation for me until about 6 years ago, is just refer out, refer out, refer out. And eventually, I had a patient who I'd helped her through a whole lot of other things leading up to this. And she came in with probably grade 3 knee degeneration. And I looked at it and I pulled up my reference for the best knee surgeons in the area. And I was getting ready to refer her out. And she asked me if I would at least try because she
Mhm.
didn't want surgery. She had some interaction to anesthesia in the past. She would rather not play tennis ever again than have to go through surgery. And she viewed me as maybe an option that could help her.
Mhm.
And so, even though that's not really in clinical standards, how I was operating at that day, I decided, okay, if I look at this degenerative knee and I wanted to put together the absolute best approach to slow, halt, or reverse knee degeneration, what would that look like? What does research have for us that we already know is effective? What are some new things that we can build onto that research, and how do we package it together to make an impact? And that kind of sparked this journey. I dug deep into the research. I learned new techniques from PM&R docs and orthopedists. I took some of my training in Europe, applied it to this system. I looked for technology. I dove deep into nutrition and really folded all of that into a plan that could be streamlined, consistent, effective. And we found that it was really effective. It worked really well. We got astonishing results with this first patient. Still to this day, I think we saw her 6 years ago. She's back to playing tennis. Surgery's completely off the board. The grade 3 knee degeneration, which she had confirmed on imaging, is functioning really well. She can extend her knee, bend her knee, lift weights. All of the things that we would hope for in an outcome for surgery are there in a completely conservative approach.
Yeah.
So that's kind of the background that led into it. Is a patient asked me, and we
Yeah.
dug into it and found a way.
Sometimes those are the best ideas they come from the patients, right?
Hmm.
Chiropractors, if your website traffic or Google Maps visibility has felt a little unpredictable lately, you're not imagining it. A lot is changing behind the scenes. AI is reshaping how search results show up. Competition in the map pack is getting tougher, and simply ranking well does not always translate into new patients. That's why Propel Marketing and Design is hosting a free chiropractic SEO workshop. You'll learn what's actually changing with Google Maps, how AI is impacting the way patients find and choose clinics, and what small, realistic updates you can make this year to stay visible and competitive. This is not a high level talk or a bunch of jargon. It's a practical step by step workshop built for busy clinic owners who want clear direction and next steps they can actually implement. Save your spot for free at propelyourcompany.com/MCM SCO workshop 2026. And we'll see you there. Now, let's take that particular patient.
Yeah.
What is a treatment plan? Obviously, it's all different, but what are we looking at as far as potential frequency and duration?
Sure.
Did you guys package up certain things like, okay, you're going to do some rehab for the hip, or
hmm
like give us a little bit of insight of what that looked like. Just it's obviously it's a framework. Every treatment plan is going to look different, but just want to get people to have a
Yeah.
context.
It is a framework.
Yeah.
It is actually a pretty highly structured framework.
Yeah.
And just to preface that, if you had an orthopedic problem, like you thought maybe you needed a hip replacement, would you go to your family practice MD and ask them if they would do a hip replacement for you?
Yeah. No.
Probably not, right?
Yeah.
They don't have that exact. They're an MD, but they
Mhm.
don't have that exact skill set. But let's say we go to that same family practice MD and you give them some anesthesia, a surgical saw, a new hip joint, and some nurses to help. Would you then ask that doctor to do your surgery? Is that enough supplies for them?
No.
No, right? It's they're not specialized in the right way to do that procedure. And even if you load them up with all the same tools, all the same equipment, that's still not the right person to put all of that together for your hip replacement. You want to go to somebody who actually has not only a framework, but a consistent result of we have to do A, B, C, D, 1, 2, 3, 4, and then we're going to get the right result. And so what I've found in doing all of this is there's really good chiropractors, just like there's really good family medicine doctors
Mhm.
who you could go and ask, hey, will you work on my hip? And then you could give them a bunch of the same equipment that we use and say, okay, will you work on my knee? But really getting the framework and the whole system down consistently and getting the training to do that is what's going to elevate them to actually get the results. Because these are not easy cases.
Yeah.
With training and systemization, we can make them much easier, much more effective. But as I get into the system, I don't want people to necessarily just go dabble, throwing darts at it and put the name non-surgical joint replacement behind it. That's why we trademarked it, so we can kind of control what that looks like in the clinic setting. But all of that aside, what the system looks like is about an 8-week program.
Mhm.
It's 8 weeks in the office. They have to continue to do a few things on their own afterwards. In those 8 weeks, they're going to work with me 2 times per week, me or my team here. On each session that they come in, we're going to be addressing their joint health, not only in the degenerative joint like the knee, but we're also going to look at the chain. We're going to look at the SI joint and spine, be good chiropractors in that regard, look at the foot.
Mhm.
We're going to be using some existing and some novel capsule mobilizations to put some load and change into different aspects of the capsule around the joints. We're going to be treating that entire area and some specific areas with radial and focused shockwave therapy.
Mhm.
And if you have access to it, we have a protocol that brings in extracorporeal magnetotransduction, EMTT, which is like a super powered PEMF machine, which can really synergistically amplify what you do.
Mhm.
And then they've got really crisp grip style rehab that can be run by the doctor or by the staff of the doctor to build up what they're doing movement wise.
Mhm.
They have to repeat some of the movements at home, and we like to pair it with BFR if they're a little too small on muscle mass. Adding some muscle mass and strength will be really helpful.
Mhm.
And we try to get them on a specific dietary protocol as well. We need, if we think about the language that we have to be able to communicate with cells for change, we essentially have load and repetition over time, but all of that is washed in the body's biochemicals.
Yeah.
So those are the three things that we can affect. We can affect how much load goes into the cell, how often it's repeated over time, and what kind of biochemicals it's washed in. So the nutritional component is to wash all of those cells, supply all of those cells in better biochemicals, so that we're essentially kickstarting a healing process that will go on for 3 months to a few years for the patient.
Mhm. Let's take a short break from today's episode to tell you about the best decision I've made in my clinic in the last 10 years, and that has been adding shockwave therapy to our clinic. The outcomes have been really impressive. Certain conditions we were struggling with in the past, we're now seeing results with the shockwave therapy for that. And second of all, the ROI has been really good. You know, when you make a big investment in something, you want to see a return, and we're seeing that return in clinical outcomes and in our investment, and that's been really nice to see. I chose Keenest Medical for 4 reasons. One is the technology is top notch. You have to have great technology. There's a lot out there that isn't quite up to snuff. The second thing is they have a really good clinical training. They have an exclusive partnership with Academy of Shockwave Excellence so that you can become clinically proficient in shockwave. You do need to get skilled at it. I think that's a big differentiator between practices that are getting great results and seeing the ROI is they have a great clinical aspect to that as well. So you want to get trained appropriately. Third is they have in-house service team for all of your technical support, which is key when you're investing in a machine like this. And then lastly, they have a very in-depth marketing and business support for you so that you can launch this into your practice effectively, that you can get that ROI on it, that you can get the clinical outcomes. And they also have really good financing options if you need that. So go to kinasmedical.com, KINAS medical.com, mention MCM podcast and receive a free shockwave in practice book with a purchase of a unit. So that's kinasmedical.com, KINAS medical.com, and mention MCM podcast. One thing again, we try to hang our hat here at MCM is, marketing can be great, but I think we all hate when marketing is lipstick on a pig. And, we
Yeah.
we we do see it often where good messaging really doesn't match up with what they're getting in the office. And too many times people do slap good ideas or names on things, but then you go there and it's just like, yeah, you're getting your hip distracted and you're getting, a couple basic exercises and they're going to call that maybe a hip replacement non-surgical, so we
Mhm.
don't want that. And it's really, you got to have the substance in the meat of it. And then no matter what we're talking about today, or just any in general, bring the clinical goods, however that looks like for you. Like I've got some members or people I know that they just do ART. That's literally all
Mhm.
they do, but they stay in their lane
Yeah.
and that's what they do. And if they need something else, they've got a good chiro or PT to do the other thing. And so their substances, the ART only, or, the adjustment, whatever it may be. So you have to bring the clinical chops of what you do and feel great about, and then be able to package it where patients can understand it. And I think that's
Mhm.
what's awesome here is obviously you got all the backing of what you've done over the years with the clinical side, and then you've packaged it well, named it well. That's one thing I learned at Strategic Coach is unique naming can really go a long way because people they can picture it. It resonates with them,
Mhm.
and they say yes. Like I want my knee to be functioning well and not hindering me from what I want to do. But I don't really want to go do the knee replacement. It's some people are 47 years old and their knee is shot. They definitely don't want the knee replacement at 47, most
Absolutely.
likely, right? So it's not just the 70-year-old that we're talking about here. So can you give us a little bit of a what kind of you mentioned earlier athletes and chronic pain? What are the
Mhm.
range of people you're seeing getting results from this system?
Yeah, that's a good perspective. I think I'll try to answer that in 2 ways. Part of my expected prognosis with my limited sample size. This would be different if I had 20 certified practitioners that have 20 years of data. We've
Yeah.
got a handful of people that have been doing this for 5 to 6 years now. So that's my data pool. We grade the level of degeneration in the joint grades 1 through 4, 4 being the ones that are true bone on bone. You can hear the stones rattling together when you move the joint. That's true, grade 4. So we've run this on grade 1 through grade 4, and in different joints, it's slightly different, but across all ages, our success rates with grade 1 degeneration are greater than 94% success rates. In grade 2, depending on the joint, it ranges between 80 and 87% success rates. In grade 3, we're in the 70 to 80% success rate marks. And grade 4, I can't really name a percentage on that. It is much more hit or miss. We've had patients where they've made 60% improvement on their oats and functional assessments, and greater than that in their subjective reporting, that I would look at that knee and still say, yeah, that one might still be a surgical case. We've had others where they got really good results, but they wanted to run a half marathon and they didn't think they could still run that half marathon. So they made a choice to go on. But I would say grade 4, I really make my patients ask me to approach it with that one still, because the results aren't as consistent as grades 1 through 3. But to color that a little bit, I think most of the really severe joint degeneration that's seen in the chiropractor's office are usually grade 3 or grade 2. It's rare that a grade 4 gets to you. Honestly, in this stage, most of those are already on a surgical plan. So if we're talking about grade 3, where I'm seeing across all joints in grade 3 a 70 to 80% improvement, and we compare that to what most hospitals set a mark at for successful outcomes on an intervention, which is between 30 and 35% for most hospitals would be considered a successful intervention. At that point, we're doubling what would be considered a successful outcome in a completely non-invasive approach for those grade 3s. So it really opens up a lot of cases. In terms of age range, probably the youngest person we've taken this approach with was a 21-year-old football linebacker with a rather significant labral tear. No osteoarthritis, but labral tear in their hip. And the oldest patient that I've taken through this approach successfully is an 81-year-old that had complex rotator cuff tear, a acromial osteoarthritis, and early stages of adhesive capsulitis.
Nice. Yeah, that's one thing I think I wanted to, get some clarity. I kind of knew the answer, but for the audience, just it's not just the 70-year-old, right? There's a lot of people wanting highly functional joints for their age.
It's a lot of people that are picking up running in their 40s, or tennis or pickleball in their 30s, and their body's not doing as well as they envisioned it doing.
Yeah, just recently had an ex-professional baseball player. He's my age now, and his right hip is toast, but he's managing as much as he can, and so a lot of people out there that are still they're still healthy, young, and wanting to function at a high level. So, I think one of the things too with this is that if one were to go through your training with this, you're gonna gain a level of clinical competence, which is going to lead to clinical confidence, and then you ultimately would have the conviction to be able to, offer this in your clinic and promote it when you are trained in this, and be able to communicate with that patient with a certain level of, I want to say, it's not a guarantee, and I think that's the thing I want is like it's conviction around like, yeah, I feel good that we can help you. And obviously based on the grading of the degeneration, you're going to be honest with that patient. And then you're going to have patients that are going to get a lot of benefit from something like this. And you're going to really change some lives.
Absolutely.
Tell us a little bit about what it looks like, the different types of training opportunities for something like this. Anything coming down the pipeline? in person? I know there's virtual. What does this look like to start to get some clinical confidence around this and be able to implement in your practice?
Yeah, I'd love to share that. And actually, even more than that, I'd love some feedback from your listeners. I've been involved in chiropractic continuing education since 2011. That's when I hosted my first course overall. And I think that whole business and opportunity of furthering your skill set has changed dramatically in the past 5 years. Definitely a much bigger push towards online training, remote training. Obviously, I'm doing a lot of in-person business training with you, which I love the in-person setting. But I think the whole thing is different now that we can get the majority of our CEUs from the comfort of our home or our vacation spots. Just a different experience. So I'd love to hear from your listeners how they are getting their CEU and their skill advancement currently, and I'll let you know what we offer.
Mhm.
My emphasis is still being in the room with somebody and helping them gain their hands-on excellent skill set. So we have some upcoming courses in May in St. Louis. We're doing a combo course of non-surgical joint replacement and one of our classic grip courses with another mastermind member,
Mhm.
Tony Katakis, at his facility in Chesterfield. We are running a few similar combo courses at my clinic here in Chicago, Evanston. And those combo courses, day one is one of the joints of the non-surgical joint replacement.
Mm.
So we'll pair like a non-surgical knee replacement with our grip lower extremity course on the following 2 days. And that gives you a really in-depth learning over a 3-day weekend,
Mhm.
one full plug and play system for the non-surgical joint replacement, and then pair it with the in-depth grip approach that you can train yourself or your staff in. So those are some in-person ones coming up. And then we've built out a pretty incredible online platform as well, which is learning at your own pace. That's at gripapproach.com. And we have a 3-day non-surgical joint replacement summit that's all virtual.
Mhm.
We filmed it over 3 days in my clinic, high definition video with a professional videographer. We clipped that into crisp long segments that range from 8 to 12 minutes. And then we further clipped that down into a 1 minute quick reference guide. So as you go through that course, you receive the material the way you would in person, but then afterwards you can go back and search it and really quickly pull up an isolated technique to refresh your mind or train your staff. And that online virtual summit is also available for PACE credits if you're in a PACE state.
Mm. Nice. That's awesome, man. I love it.
Yeah.
And yeah, I took a look at it. The virtual part looks amazing. Very professionally done. I must commend you. I've done a lot of online courses and stuff. It's not easy.
Yeah, it's a unique challenge for the chiropractor skill set.
Yeah, definitely. But yeah, this is great. And we'll put the information in the show notes as well on how to link to that and get going from it. But it could be a great opportunity in 2026 to advance clinical skill set and then be able to package it, and be able
Mhm.
to understand how to go out there and really help with these particular conditions. So great work.
Yeah, thank you. I think on that point, and considering this is a marketing and business podcast, if you do this and do it well, it's a really big benefit to the
Mm.
business side of your practice.
Yeah.
And I know I've spoken on that in a closed room setting with the
Mhm.
mastermind, but this is really the way I envision chiropractors moving is into a more specialized skill set where they're not being viewed as, let's see if an adjustment would work for this.
Yeah.
They're being viewed as the real conservative expert in helping somebody overcome joint degeneration. And by getting the training and eventually promoting it, you really quickly become that expert in your community. And because we're doing an advanced technique that requires some extra training and extra equipment, we charge a good amount for it as well, a healthy amount that's really good for the practice, but it's not absurd either. It's something that patients can make a decision to do and hopefully say, hey, maybe I'm going to skip the trip to Cancun this year and get my hip feeling good so I can go next year. And I've had a patient say those exact words to me, like, this isn't a travel year, this is a health year. And ultimately, you're setting your patients up for an incredibly healthy lifestyle after they work with you on this joint, because everything that they're learning to do are like the foundations of health that we all know about. And this gives you the opportunity to make it real for your patient and for them to buy in and to do the things that are going to make their life better afterwards.
Yeah, I love it. I love it, man. That was great. And we'll put that in the show notes. I look forward to seeing you in a couple days in Park City for our mastermind. I know this
Absolutely.
episode will come out after that, but looking forward to talking business with you and having some brown drinks.
Absolutely.
All right, Ben. Have a good one.
You too. Thank you.
I hope you enjoyed this week's episode. And if you want to make the shift from busy, broke, and broken to time-free and cash confident, or you just want to continue with the exponential growth, check us out at modernchiropracticmarketing.com. Look at the MCM Mastery tab, watch the short video on there, and check out what we are doing now for evidence-informed chiropractors. We are equal parts coaching and marketing done for you. Yes, you shoot some videos, we help you with campaign strategies and ideas and really become a thought leader in your community. You shoot those videos, you send them to us, we produce, edit, and brand them to you. Then we distribute them through all of your channels. We also take them and we turn it into one good blog per month. And every other month, we have Darcy Sullivan producing a robust blog with a topic that you pick from her database to help with your SEO. So we essentially become your content marketing agency to make sure your practice is always having ethical, elegant content marketing to help grow your practice. On the coaching side, we also help you with everything from marketing ideas to business, communications, finances, anything practice growth, and really try to help prevent you from being stuck on that island. And we hold you accountable. We have a great group of doctors that are just doing amazing things, and we look forward to help you out to take that next step in your practice. So again, check us out at modernchiropracticmarketing.com and learn more.